You've used the term biofilm a number of times. Talk about specifically what you mean by that.
Yeah, so biofilm is kind of the layer of bacteria. They congregate and they create it's plaque. Essentially, you feel like the fuzzy plaque on your teeth. We talk about there's all different biofilms in the body. There's the sinus biofilm, and there's the gut biofilm. The neat thing in our mouth is we can see in the mouth, and so that thin layer, that plaque, that stuff that dentists and hygienists are so fixated on getting off your teeth, that is called the biofilm, and it's not always bad. And now there's a movement towards different types of cleanings in the office. One is called a guided biofilm management. So we're not just going in and just completely stripping and cleaning and scraping every surface and nook and cranny of your teeth. We're really looking for targeted areas. They use a specific type of stain or dye. It's erythritol based, to focus on areas where you're building up more pathogenic bacteria and just cleaning those, usually with like a water spray or an air spray or something much more gentle. And then they're re-inoculating the mouth with healthy bacteria too through various products. So that's the biofilm. And what I think what's really neat about our mouth is that it's a snapshot into the health of our body. We can see in the mouth. And if a patient has inflammation, gum disease, it's not just staying in the mouth. It's very likely they have inflammation throughout the body. And how is that impacting their other organ systems and their immune health? And I think we're starting to see a shift that physicians and other providers are understanding that oral health is paramount for their patient's systemic health. And what a nice little way to look in your patient and to say, open up, look at their tongue, look at their teeth, ask about their dental history. Do their gums bleed? And if things are in disarray, very likely they have downstream effects too. And so we need to work on trying to cleaning that up collaboratively.
Just for a little bit more clarification on that biofilm piece, is that the fuzziness you'd feel like with your tongue across your teeth, or is it more the hard plaque that would be laid down over a longer period of time, or both?
It can be both. Yeah. So the soft plaque, there's soft plaque or soft biofilm, if you will, and then there's calculus or tartar, and that's the more calcified. Usually, it's been there for a long time. That can be a sign. Actually, everyone thinks that's a hygiene issue. It's not always. It's a sign that there's too much calcium in the saliva potentially. So that could be a sign of K2 deficiency, because K2 tells calcium where to go in our bodies. It's showing us that your salivary health may be a little imbalanced. Like maybe you do have a little too much calcium. And it's not always a bad thing per se. Like it can be protective of the teeth, but when it sits next to the gums, then it can cause gum inflammation and bone loss too. So you do generally want to clean that off. And that's something that you really have a hard time cleaning off at home. That's where you'll feel the hygienist kind of scraping away to get that calcified tartar or calculus off your teeth.
Talk more about that process of doing a more gentle cleaning, because that's new to me. And I wanted to get into the fact that it does feel so abrasive when we're getting our teeth cleaned, even by a natural dentist or hygienist, that scraping against the enamel, taking off the calculus. Basically, talk more about what you got into before, this gentle approach, and then how you feel about scraping against the teeth in a general sense.
Yeah, I think cleanings are very important. I do feel we treat everyone the same. The way we approach cleaning, I mean, all of dentistry, I think we just treat everyone the same. And that's just not the case. Everyone is different. So I do think, and I've personally experienced really aggressive cleanings before too. And I think there is that middle ground. I do believe patients need to go in for cleanings. I like them to see a dentist regularly, because we're not only looking for disease, like gum disease and cavities and bone loss, but we're also looking for like oral cancer and things that are very important to be screened for. So the more it's called guided biofilm therapy. It is newer. It's hard to find dentists doing this, but more and more are. They will use a really gentle air abrasion after they've used a very specifically targeted erythritol stain that targets plaque that has been sitting there for several days. usually I think it's 72 hours or more. And so it will stain it usually bright purple. And so the hygienist can then really focus on just the areas that you're kind of missing. So instead of like just scraping and away everything, but instead of those tools, they're using a gentle water spray, or sometimes there can be like a fine powder spray that they use. And patients find it a lot more comfortable. And it's just not, they're thinking more of microbial health, I think. And so a lot of times it will be coupled with oral microbiome testing too. If they feel like a patient's really dysbiotic, they'll want an oral microbiome test and then put them on a protocol, get them in for regular cleanings as part of that protocol, and then retest. So it's really great. I think I've seen it become more popularized in the UK, actually. But then the importance is after to maintain healthy bacteria, and that's where the prebiotics and the probiotics can come in as well.
And with that type of cleaning, would the hardened calculus be left on, or at least partially?
No, they do take it off, but sometimes they'll just take it off with like a water spray, or sometimes they'll use a laser. So they do tend to steer away from those metal tools, although sometimes you need to pick one up. I don't want to like villainize those. I just think we've oversimplified it. And, you know, if you've been in the chair on the receiving end, it can be really hard to sit through that. It is uncomfortable, and your gums do hurt. And so this is where we also get this negative emotional association with the dentist, which is something that's really important to me at my practice, is to focus on the emotional health of our patient. I think we do forget that there's a human attached to those teeth and gums. You know, we get so laser focused on the dentistry part of it. And, you know, it's kind of that like, oh, you're fine, just toughen up, we'll get through it. You know, I have to get this calculus off. And it's like, well, your patient's like white knuckling it in the chair. So is there a different approach that we could use? And that's where, you know, some of these lasers and water sprays and things like that can be really beneficial if a dentist incorporates them into their office, which that can be harder to find, but we're working on that. We're trying to create change.
For a hygienist who's working more gently or moderately using the metal tools, what's the physiology like on the tooth? Would that be something you'd totally avoid given what you know? Because again, coming back to this theme of how intense that can be for the patient, it's just something I've thought about a lot and really wanted to get a good answer from you on whether or not that's actually beneficial overall, or it's scraping away at the enamel.
I think it's beneficial if we don't overdo it. Like if you're just focused on that hardened tartar. But I've seen hygienists, you know, they have on their magnifying loops and they're trying to get every speck of buildup off the teeth and scraping because they think there's tartar or calculus there, but maybe actually it's just a little defect in the tooth. And then, so that is wearing away enamel with each scrape. So I think it's a mindset shift of the profession too. And then also knowing that every segment of biofilm, every segment of calculus and tartar, like it's all not terrible per se. And the thing is, it's going to come back again. So to do this extreme detailed, thorough cleaning just to have it come back 10 days later, you know, I think there is that balance. And looking at your patient, how unhealthy are they? But, you know, if they have bridges of tartar and calculus, which we see, we have to get that off. I mean, that's just going to create this uphill battle of dysbiosis for that patient. But I think we could ease up a little bit on the scraping. And so I think you can just speak up for yourself and just, you know, say, well, first of all, try to find a dentist maybe doing guided biofilm therapy. And if you can't, just speak up and say, hey, can we just go a little easy? Can you use more of the polishers and less of the hand tools? Like, is that a possibility? Just have a conversation with them. Yeah, it's a work in progress for sure.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Something that quite literally keeps me up at night. I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.